Hello, my name is Asher Delerme. I am the Executive Director of the Chemical Abuse Services Agency, also known as Casa. I am happy to personally welcome you to our organization, an organization that's been in existence for over 3 decades with a very special mission for the communities of New Haven and Bridgeport. For the last 3 decades, we've been providing culturally centric behavioral health services to the communities of Bridgeport and New Haven. And the fact that you're sitting here and watching this video means that you have the attributes and qualities that we're looking for to be able to fulfill that mission. So again, I personally welcome you to our organization and wish you the very best. Thank you.
In the 1990s, the diverse ethnic communities of Connecticut were severely underserved when it came to effective addiction services. Residents had to travel long distances for aid or pay thousands to healthcare providers on a limited insurance plan. Luckily for our communities, a group of Bridgeport civic activists, Jose Ortiz, Reverend Wilfredo Ramos, and Edith Sanchez, put together their vision to correct this and created Casa Eugenio Maria de Hostos. Since that seminal moment, Casa has created an outstanding network of recovery programs and transformed the lives of over 25,000 individuals. Currently providing service out of Bridgeport and New Haven, Casa has become a staple in the multicultural area that it serves.
So multiculturalism really is about meeting individuals where they're at in their community, understanding many concepts that involve groups that are traditionally marginalized. So concepts of colonialism, concepts of marginalization, concepts of migration as well too. All of those things have a very specific impact on the communities that we service.
In all of the communities that Casa serves, our mission is to provide holistic and culturally competent, community-based behavioral health services to individuals, families, and communities seeking recovery from addictions, co-occurring disorders, and related behavioral health issues. This mission is instilled in the employees and is evident in both the New Haven and Bridgeport facilities.
The bulk of our services are here in Bridgeport, where we have, again, clinical residential services, outpatient residential services, women's clinical services, and in addition to that, we also are providing supportive housing. We have one permanent supportive housing program called the Areto Apartments, and we also have several transitional housing programs, one called Noble House for HIV/AIDS positive individuals, and the other program is called Recovery House, which is for individuals who are transitioning from treatment back into the community.
Our Bridgeport program, Casa Hostos, all of the services are in Spanish, and that has 2 levels of residential treatment. There's 16 beds. There's also an IOP and a day treatment, which is a little bit, day treatment's a step up from the intensive outpatient. And then they have low-level outpatient.
Una persona me dijo, no te preocupes que te vamos a llevar a un sitio que tú vas a estar bien. Son latinos. ¿De dónde es? Casa Hostos. Tenías razón. Se portaron como familia, vaya. Nunca había tenido una experiencia como esa. Nunca.
Propia casa.
Nunca. Puerto Rico yo lo adoro, pero le falta mucho. Casa Hostos.
I think if you would talk to the staff, they would say it's unique. It's a family atmosphere. I mean, we are running a business, but in general, folks feel very good about the work that they're doing with their colleagues, their supervisors. It's a team approach. We just have to be mindful that when people are coming in, not everybody's in a good place. So obviously we have a lot of long-term patients who have extended bottle privileges and who are working and are reunited with their families and are employed, and they're really viable parts of the community. And we also have people who are coming in here and they're homeless and they didn't have a bed the night before, or they haven't had a meal in a few days, or they may have just been discharged from the hospital and their lives are still chaotic. And so people are at different places when they come in the door, and our goal is really to serve them and meet them where they're at.
Meeting others where they're at is at the core of Casa's vision. That's why we've incorporated Proyecto Nueva Vida and Project Courage. Proyecto Nueva Vida is an outpatient treatment program in collaboration with HIV care services at Optimist Community Health Center and vocational services at the Co-op Center in Bridgeport. This program, which means the New Life Project, serves Spanish-speaking male and female residents who may be poor, unemployed, or have a criminal background. Project Courage, on the other hand, is a multi-level outpatient program dedicated to serving pregnant or parenting women. There are 2 levels of care, which are day-intensive outpatient and low-level outpatient. This gender-specific program caters to women by providing transportation and babysitting services if they reside in the city of Bridgeport. Located in Bridgeport's east side, Project Courage blends in well with the rest of the neighborhood and offers a warm, secure, nurturing, non-institutional environment.
One of the reasons we stayed at that site is because it looks like a house, and so it reduces the stigma for the women coming into the program and for the children. The first floor really looks like somebody's living room, and we provide babysitting on site, and so it's very cool for the women and for the kids. Commission on Accreditation for Rehabilitation Facilities is one of the options that opiate treatment programs have. We have to maintain accreditation in order to run an OTP. For our purposes, we're accredited for all of our clinical programs for our behavioral health and our opiate treatment programs. And that includes residential treatment, outpatient treatment, day treatment, and medication-assisted treatment.
Most of the employees that come here, they seem like they've had an experience working with people already. You have to be a compassionate person, and you have to want to work with people. You can have a person like a counselor who you can converse with, and you can talk about things that you normally wouldn't talk about with maybe a friend or somebody out there on the street. You can converse with that person, and you can get feedback about how they feel about a certain thing, and you can use their opinion to sometimes make some decisions for yourself.
CASA predominantly does medication-assisted treatment. We have a large methadone maintenance population, close to 500 patients at this point. We also do intensive outpatient. We have community outreach, we have Latino outreach, we have on-site primary care through the Fairhaven clinic. We really do have a niche in the Latino community, but over the years that's actually changed. And so we are serving a fair number of African Americans, as well as folks from all over. I think the feedback that we get is it's different at MOS. We really focus on maintaining a small caseload. The clinicians have a designated caseload, and they see their folks individually. You'll see if you walk around, people are in each other's offices, they're collaborating clinically on cases, they're venting sometimes about or trying to get their peers' support around what to do in a particular case, or their supervisor. And it really is just a very collaborative, close-knit group of clinicians. We're very fortunate to have the team that we have here.
It's a very good atmosphere to work in. The supervisory staff is fair. The management is fair. I'd have to say that working in this agency has been by far the most positive experience. I like the fact that we get to deal with the clients, as a methadone program, not all the clients are on methadone maintenance, but most of my clients are. So we get to help them for a long period of time. We get to see them evolve, and we get to see them from, street level when they're really, really in bad shape. And hopefully, we can help them to get jobs, better relationships, and, it's really very satisfying to see.
Our benefits, for example, it's an 85-15 on the dental, on the medical, and in the vision. We also provide all other supplemental insurance like short-term disability, long-term disability. We have a life insurance that it's fully covered by Casa, the cost of the employee's salary. We have a lot of holidays. We have 13 days or 12 holidays because we do the Thanksgiving Day, for example, it's a 2-day holiday. It's a Thursday and the Friday following Thanksgiving. We have holidays that the for-profit companies will not have, like Three Kings, like Good Friday. Those are, holidays that normally you don't see companies giving their employees. We also have vacation. We have different tiers for different employees.
In addition to the many benefits mentioned, Casa also offers a free checking account from People's Bank if you choose to have your wages direct deposited. In addition, a retirement account is offered as a match contribution, up to 5% of the employee's salary. Casa also covers the full cost amount of CARF-related training services for staff and pays for the full cost of license renewals, registration, and application. Furthermore, as an incentive to those full-time employees pursuing higher education degrees in social service, Casa will allow up to 3 hours of release time from a 40-hour week schedule per week during matriculation. For employees going through hardship, an EAP or Employee Assistance Program is offered, whether the problems are professionally or personally related. Programs and benefits like this ensure employees are supported and feel valued while they assist clients to become contributing members to their families and communities.
We really believe that recovery is achieved not only in the treatment setting, but also out in the community as well. So we want to make that connection between what we do and where people go back in terms of living the rest of their lives.
People are all over the map in terms of where they are. We're just trying to convey we're here to do the best we can to help you get back to a place of a meaningful life. And we have an amazing group of clinicians at this site in particular, of people from all different cultural backgrounds. We have a nice mix of men and women. Demographically, we have older clinicians, we have younger clinicians, we have folks with master's degrees, LPCs, LCSWs, we have folks who are in recovery themselves. We do a really good job, I think, reaching out and recruiting and maintaining staff who are also in recovery, and so there's that balance in this clinic.
One of the sayings in the addiction community is that there are multiple pathways to recovery. So that means there are multiple techniques, multiple avenues that an individual can follow, and we feel as a treatment organization that our staff also has to be multidisciplinary in terms of how they provide services. We also encourage our staff to be as creative as they possibly can be. So therefore, we have a diversity of different activities that we provide in addition to the usual clinical groups, therapy, and individual therapy that we provide. But we also are very creative in celebrating who people are, affirming their identities, making sure that individuals feel welcome, and using any creative means possible to do that. So we incorporate poetry, we incorporate music, we incorporate movement, anything that is creative that helps us to help clients help themselves. Organizando mis pensamientos alrededor de la clave. Y en la recuperación tenemos que tener una clave también para organizar la recuperación.
You have to love the work to do it. I mean, to be here, it's intense. It can be emotionally draining. You know, we're working with a very sick population at times. There's certain skill sets you can't teach. So if it's not innate, if it doesn't come naturally to have that compassion, it doesn't always work. But we've got a really super group of people here.
Our expectations for new employees is that they continue to understand and develop their understanding of the organization and how we approach services for our communities. So I hope this video has been helpful to you. I hope that it may have answered some questions that you have, or it may have created other questions. But the one thing that I really want to leave you with is that our organization is an open door organization, and if you have any questions, if you have any comments, if you have any suggestions, we are always happy to hear those. And I want to wish you continued success and the very, very best as you work with the populations that we work with. Thank you so much.